Steinbrech here with the weekly live on the Male Plastic Surgery channel with Dr. Douglas Steinbrech. Dr. Steinbrech, how are you doing today?
I'm doing great. We're in the California Los Angeles office in Beverly Hills. Got a full day of surgery. Actually, Tom, today, and we have to do a full episode on this.
Yes.
Calf implant day. We did 4 calf implants today.
Really?
Rocking. Really great. Some great results. And I cannot understand why, when everyone, not even guys that skip leg day,
Yeah.
but why, when the guys have these just incredible upper bodies, and the next, how abs are the new chest. Well, the
Yeah.
next one down the road, it's going to get back down to calves and thighs. Because if you look at a dude that has a great set of thighs and calves, like, that's big, but it's definitely an issue. It's definitely an issue because so many people can't develop, and they're not missing like that. I promise you.
Yeah.
They're getting very defined kind of calves, but no mass. And man, we helped 2 of these boys out today. They look
Wow.
fantastic, and they wish they both were. They're both, one was late 30s, the other is late 40s.
Yeah.
I wish they would have done it 20 years ago, and I just don't know why. I think people don't know that it's even a possibility.
Interesting. I have a kind of a prediction. I don't know if he's coming back, but with Messi playing in Inter Miami and soccer becoming more prevalent here, more popular, I kind of see guys and people watching and say, "Wow, those guys have really sick calves."
Yeah.
And they kind of themselves, they can't get there. I think there'll be like almost like even if he goes back to Argentina, which I think he will. I just think the fact that the rock, like you see the European players. Their calves are huge. Doc, this is actually pretty cool because like we've been doing this a few weeks. We kind of got some regulars, so we're gonna do some shout outs real quick before we start. We normally don't do this, but we will. 111 was in the waiting room. He was hanging out. Thanks so much
Awesome.
for being there. Jocelyn decided to show up. Even she's hanging out this week, which is pretty cool. So you know her. Frankie Duke came back after a little break. Frankie, welcome. He always has good questions. I think he's a soccer fan because he knows Messer's Inter Miami. I'm sorry, Inter Miami. That's his team. And 111 loves the shout out. He played yesterday for Argentina. All right. Frankie Duke, I believe you're a soccer fan. Just predict below if soccer is going to take off in the U.S. Again, if it is, I do think you will see an uptick in calf requests. All right, Doc. So we're going to jump in with a little bit about fat transfers today. Those on a replay crew, we do a live every week. So make sure you check it out. We usually do it on Wednesdays or Thursdays. So I know you're watching this on the replay, but make sure you check out our lives with Dr. Steinbrech. So I want to almost, I know we ask this every week, but I want to almost treat this as somebody watching this for the first time. So the first question you always got to ask a plastic surgeon, are you board certified by the American Board of Plastic Surgery? So Doc, why is that question important, and why more important is to be certified by ABS?
Yeah, it's so important because it shows that you did your homework. First of all, it shows that you went through a full, proper, either combined general surgery and plastic surgery program, but then you did your homework. You studied for the exam. It's a very difficult exam to pass. Then you have to pass your orals. And when I took my orals, 26% of the guys, of the men and women that went out to Phoenix, Scottsdale, 26% of them flunked.
Oh, wow.
And it's not that they didn't know their stuff. It's just the bar was so high, particularly that year. So they're very selective, the American Board of Plastic Surgery, and they still are. So it's really important. There's so many other areas, and I don't want to be a hater, but they're like, they weren't fully trained. They could be a dentist. They could be a primary care physician. They could be an emergency room doctor, but they just say they're a cosmetic surgeon. Yeah. And I'm not going to mention what societies they are, but they make like kind of crackerjack boards that you basically send in your money and you get your diploma in the mail. And the American Board of Plastic Surgery, and then the Aesthetic Society, that's really the top. It used to be known as the American Society of Aesthetic Plastic Surgery, but they switched over to the Aesthetic Society. I'm on the board for that because it's just more than just plastic surgery.
Nice. And also continuing education is important too, right? So if you're certified. You don't just set and forget every 4 years. There's certain things you need to do every year to keep your board certification, correct?
Absolutely. It's so important. For example, for the Aesthetic Society, we have our annual meeting. So I'm the vice chair of the program committee and the education committee. So like, we worked really hard to get good on the state-of-the-art panels about what's the newest and have the best people speaking on those. And we put a lot of time into designing those, and it creates great education for our folks. Nice. So if you go to any surgeon, you want to make sure they're from the Aesthetic Society as well. Is critical.
All right. So each week we try to pick a theme. I mean, sometimes we get questions from the field. We get different type of themes. We're going to focus a little more on fat reduction today, and then kind of lead in to body banking, and that'll be kind of the focus, I think, next week. But give us what are options for fat reduction for somebody when they present to you?
First, our policy is always no judgments, and we believe, we've said this before, so I'm going to make it brief. However, you need to do what you need to do to get in shape.
Correct.
That's the most important thing. We don't care how you do it. You know. It can be diet and exercise. It can be a surgical procedure, a lap band. It can be a bypass. It can be a
Ozempic,
gastric ring. It can be Ozempic. Ozempic and Wegovy have been true game changers. People now in the plastic surgery industry say these may indeed be more important than Botox. This is our Botox moment for weight loss. The only people that are really having a bad time right now are bumming out are the gastric sleeve surgeons, but that's okay. They had their day. They really had their day. They were fine. But we're always happy. Doctors can always do other doctor things. We're always happy to get rid of cancer. We're always to get rid of heart disease. All the cardiac surgeons. I was going to be a cardiac surgeon before I realized how much fun plastic surgery is. Boy, oh boy, am I glad I didn't become a plastic surgeon or a cardiac surgeon, because that dried up. So, but we're happy. We want all the cancer surgeons to lose their jobs. We want all the heart surgeons to lose their jobs. We want all the obesity surgeons to lose their jobs. We want everybody to be healthy. Exactly, and that's. But those are the different areas of weight loss that you can use.
Okay, and then once you present, you lose the weight, and you lose the weight. You dedicated therapeutic lifestyle change a whole bit. And now I present to you, and you know what? I got some pounds to lose. I got a little loose skin. I maybe want to move things around to have like bigger, guns. What are your options for fat reduction, and what do you do with that fat?
Well, we like to bank it, and we do it for a couple different reasons. Number one, by putting it in other areas, you can subtract from one area and then add to the other area. So that gives a more artistic, more athletic result. Sort of like a sculptor, how he moves the clay around on the body. And we do the same kind of thing. But the second reason is really, old-fashioned liposuction. If you just suck it out and throw it in a bucket, you're going to get rebound fat. It's a real thing. It comes back as belly fat. It comes out inner outer thighs. Undesired areas. We don't want that. Yeah. We want it to come to banked areas of interest. So we want you a year from now, you had your surgery, you had your liposuction. Instead, you sit down and you have that nice ice cream while you're watching Netflix, and you scooping it away. And we don't want it to go to visceral fat. We want it to go to the areas that we bank. So guilt-free, you can have your Netflix ice cream, and your shoulders get wider, you get more definition in your chest, and your traps pop, and that's what we want. And that's what you get with body banking. Or put it in your butt.
So for fat reduction, you have obviously surgical options, liposuction / body banking. And then also cool sculpting, but that's more for non-surgical, like lesser expectations, but lesser results, correct?
Cool sculpting really works. I did cool sculpting on this side. I looked at it today. On this side, I have a blob over here. On this side, there's just much less. It's just skin. Interesting. And I never ever, Tom, this has been 10 years ago, I never ever did the other side. I'm actually surprised. We thought the cool scope, people, it was very, very popular, but it's one of the technologies that actually really, really works. There's a lot of stuff out there that doesn't.
Yeah.
And it kind of had a bad rap because like one or two people were getting paradoxical hyperplasia. They're actually increasing, which you can always fix. But that was like 0.01% of the population. But the rest of it, man, it is a really good technology, the Cool Sculpting is.
Nice. Now, what are possible risks and complications? You know, you lose the weight, good lifestyle. You say, hey, I'm going to get some liposuction. What risks are there associated with liposuction?
There is a risk. There's a risk that you may be in a very bad relationship that dissolves because you finally realize that you should be getting more respect for yourself. And when you get in shape, you realize that you're putting up stuff in a bad relationship that you
plastic surgery breakups.
So the risk, there's a significant degree. There's a significant risk of splitting up with relationships. And sometimes I have to warn people when they go begin their transformation, make sure they have a really solid footing on who they are and how they feel about the relationship, and make sure they divorce that from what's happening physically. So that's one thing. That's one risk. But other risks that can happen with weight loss is really you just want to keep it off. People run the risk, feel like that if they keep it off, are they going, or if they have a torso tuck or a tummy tuck, are they going to accidentally eat through it? Doesn't really happen. The greater fear is not the greater fear is fear itself. That is the greatest fear. And the reason is everyone, like rings are high. What if you lose all that weight and you have a better life and you're much healthier and you get off all the medicines that you're taking and you get to the gym and you have the best body and feel the best for the rest of your life? That's the biggest risk, the fear itself.
Got it. So we're gonna do a little segue into next week, and you kind of touched on it, but I want you to expound upon it. So I really want you to set us up for next week because the plan is going to be all about body banking. So what is body banking, registered trademark, versus traditional liposuction?
It's an error. It's an error in the balance of the fat cells in your body, right? Yeah. So it's traditional liposuction, and it's all about math. When you do traditional liposuction, you're going to take out a certain amount. This is really very, very important. So you got to listen. You're going to take a certain amount of fat off your body, right? You either have to do two things. After that, you either have to decrease your caloric intake or increase your caloric burn, right? Or the same 5 gallons of ice cream that are going through your mouth before surgery, if you keep going with that same 5 gallons of ice cream, they're not just going to pass through you because some guy down Park Avenue said they did liposuction. No, it doesn't change what happens, the metabolism of your body, what happens.
Correct.
So you did all this liposuction. They took out some fat cells, but the fat cells left behind will continue to be the reservoir for that same 5 gallons of ice cream. So it's just going to go to the ones that remain, which are visceral fat cells, inner out cells, all the areas that you didn't have before. In fact, that's why we do liposuction all the way around, because I see a lot of people, they do a little bit in here, a little bit out back here. They miss the sides, and they actually, I've treated underwear models that come in and they got wider after liposuction. Well, guess what? That's called rebound fat. That's called catch fat, compensatory hypertrophic hypertrophy, which means the cells out here that were left behind took on the extra ice cream. So unless you do both of those things, either increase caloric burn or decrease caloric intake, the amount of fat, not the cell number, but the amount of fat is just going to be redistributed to other areas. That's catch fat. That's rebound fat. It's a real phenomenon.
And you also have somewhat of a proprietary way that you kind of do it, or at least have an advantage per se, versus the older techniques. Correct?
Absolutely. And the way we do it, it's a philosophy. It's not. It's a sculpting. It's not an easy thing to do because You sucking it out is easy, right? And then you just like make sure that it's even, right? But to put it back in, that's more an artistic thing. It's more like a sculptor. You have to know how it's going to look like, and you have to know when they're lying on the floor, on the table. You mark them up as they're standing to where it goes, but it really takes experience. It takes someone that has a lot of experience, and we've done thousands and thousands of cases at this point, particularly for men, also for women, but particularly for men. So I know exactly how high on the shoulder it's got to be. Because people, when they start out, they throw this thing, and it looks like a lemon hanging off the side of your shoulder, and I know exactly, and people put it down into the lower chest where it looks like a breast afterwards. We know how to do it, put it in the upper inner chest for good, sexy cleavage. So there are a lot of different subtleties to this that take a lot of experience. It's technical and it's artistic, and the other thing is about the post-operative course. If you just go in there, slam dam, thank you, ma'am, and then they go home and they're on their own. No, there's so much that needs to be done in terms of molding, in terms of smoothing. And my patients know this. If you're on my patient, you're on this, you know how much I torture you post-operatively in a good way. I'm supportive. My whole team is supportive to make sure you have a perfect result, or as perfect as possible in terms of the molding of everything post-operatively, so that you have a minimal chance of a complication and a maximal chance of having the very best result that you can get.
Frankie has a question. Frankie's a regular. Welcome back, Frankie. Actually, he's been missed a few weeks, so welcome back. Pretty cool to have regulars come and hang out. You obviously did liposuction, your career, nutritional stuff, but how long have you been doing body banking for? I know the answer, but I'd like to hear you share it with me.
We started that in 2010 or 2011, and it just really got going around 2012, 2014.
Nice.
So that's why this is our 10th anniversary. And I started putting the abs to get more definition and more of a pop to the abs.
Yeah.
And then when we started doing that, we went to the chest and the shoulders, and then to the biceps, triceps, forearm, calves, quads, everywhere, anywhere where there's a bump. I always say that the female plastic surgeons care about 4 bumps, 2 in front and 2 in the back. But I care about 80 bumps. Your 8-pack, your glutes, your quads, your calves, your biceps. I care about a lot more bumps than 4.
I love it. So the cool thing is, I don't know where we have this. I got to check the schedule, but there's a chance that you and I might do the live together next week. We'll be together in Austin for the meeting. I had to check the schedule. Maybe it might make sense to do it in person. So that'll be pretty cool.
We should do it at the booth.
Even better. So we do a live, and we'll have our mobile, so we could also include our friends on Instagram. I'm still trying to find out people watching. Doc and I, this was the original version of this was on Instagram, but the technology got a little better with YouTube. But I think there's a way you can maybe stream this also to Instagram. Let me find out, because I think StreamYard, there's a way to do it. I got to figure it out, but it'd be pretty cool to maybe broadcast to our friends on Instagram as well as YouTube. So, Doc, kind of a quicker one today, because you're probably tired after a long day of doing a whole bunch of calf implants, etc. Why don't you give the closing remarks?
Just want to encourage people, and when we talk about weight loss, start at the beginning of your journey. We're happy to help out. We can get some advice on Ozempic or Wegovy and all those things. And one of my best friend girls, I should say, who took out my appy, Chris ran over at NYU. She just did fantastic. She does fantastic surgery. But I know on both coasts, we know tons of people that do gastric surgery for weight loss. So, but come to us at the beginning of it, because we have ways. We have people that have gone all the way through the journey. Alex Poro, Anthony Lally. Their documentaries on Amazon. You have to look for them and let them inspire you. It's time to change your life, and we can help you do that.
Love it. Have a great week, everybody. We'll see you next week. And Doc, I'll see you next week, and we'll see you both in person. Have a great week, everybody.
All right.